Hello, everyone, and thank you for joining us for the Bias Capstone webinar. We are looking forward to sharing behavioral insights with you all today. I'm Caitlin Anzalone, a researcher at MDRC's Center for Applied Behavioral Science. My research has focused on applying behavioral insights to social and education programs throughout the U.S. I've worked as part of the Bias team for the last 5 years, designing, implementing, and evaluating behavioral interventions. Next, I'll let my colleagues introduce themselves.
Hello, everyone. This is Patrick Landers. I've been working on MDRC's portfolio of behavioral science projects for over 3 years now, and I'm really looking forward to today's conversation.
Hi, everyone. It's Xavier Alamani. I work on many of the behavioral projects here at MDRC, including the next evolution of the Bias project, which will be discussed later in the webinar. I'll be facilitating the question and answer portions and also presenting the results of poll questions that we'll ask throughout. Thanks. Caitlin?
Great. So who we are. This webinar is held by MDRC's Center for Applied Behavioral Science and the Office of Planning, Research, and Evaluation in the Administration for Children and Families in the U.S. Department of Health and Human Services. MDRC is a nonprofit, nonpartisan social policy and education research firm dedicated to learning what works to improve the lives of low-income populations in America. CABS is a unit of MDRC, and our mission is to combine MDRC's expertise in social policy with insights from behavioral science to develop innovative and low-cost solutions. In a nutshell, the goal of CABS is to use behavioral science to make social programs work for the people they are designed to serve. The Office of Planning, Research, and Evaluation, OPRE, who sponsors the Bias Project, studies administration for children and families programs and the populations they serve through rigorous research and evaluation projects. These include evaluations of existing programs, evaluations of innovative approaches to helping low-income children and families, research syntheses, and descriptive and exploratory studies. So lastly, as part of this event, we would like to encourage participants to tweet during and after the webinar and be part of a conversation on social media using the hashtag #PovertyNudge, which should be up on the screen as well. And our Twitter handles are also at the bottom of the screen. Okay, so let's jump into the content for today. The webinar is largely based on findings of the Behavioral Interventions to Advance Self-Sufficiency Bias Project. The two partners that you just heard, CABS and OPRE, are the two who launched the Bias Project. We worked with a team of researchers that included staff from MDRC, MEF Associates, and professors from universities across the country. Bias was designed to apply insights from behavioral science to human services domains within ACS. First, the project applies behavioral principles to large-scale human services programs. We used a specific method of behavioral diagnosis and design, which we'll briefly describe today, to diagnose problems and develop innovative solutions. The goal of Bias was to develop quick, sustainable, and inexpensive changes that were focused on immediate outcomes with incorporating behavioral insights. So the lessons that you'll hear today are based on the findings from the Bias Project, along with a variety of other research. So our goal today is to highlight key principles from behavioral science that hopefully you can apply directly to your programs to improve various elements of your program. We hope it will be practitioner-focused and as a workshop style, where we aim to equip you with a few principles for leveraging insights to improve your programs. For example, increasing participation in your services. The techniques and principles that you will learn today are practical and often easy to implement, but it should be noted that to harness their full effects and to ensure that resources are spent appropriately, the formal process of behavioral diagnosis and design, which we'll explain, is strongly encouraged. So one component of the webinar will be that we will have polls where you can interact with us and submit responses in real time. So Xavier will present the poll results throughout the presentation. So we wanted to go ahead and give this feature a try to make sure that everything is working. So you should see something pop up on your screen, and to please submit a response to the poll now. And the question is, in what area do you work? A, research and evaluation, B, state program administration, C, national program administration, D, local program administration, or E, academia. So additionally, please submit questions via the text box as you think of them throughout the webinar. At the end, we will select as many questions as possible to answer live for the full group. So while you're answering this poll question, I'm going to briefly review our agenda. So we'll start with brief findings from the BIAS project. Then we'll jump into behavioral diagnosis and design. And then we'll focus the majority of the presentation on the principles of the Simpler framework. The Simpler framework is a framework that was developed after conducting BIAS tests in 15 evaluations. It's a synthesis of different behavioral concepts that we used across our tests and across our domains, and we hope to share it with you today. Next, we'll share some resources that can help you learn more about behavioral insights, and we'll have 2 Q&As throughout the session about the webinar.
Yes, and the poll results are in, and they show that everyone is comfortable using the polling system, which is great. Actually, they show that 18% of folks who are attending this webinar work in research and evaluation, 34% work in state program administration, 6% in national program administration, 37% in local program administration, and 4% in academia.
Great. And remember to use the chat function throughout, just to repeat, for any questions that you have or any clarifying points that you might have missed. So a little bit more about the BIAS project. The BIAS project worked in 3 main domains. The first domain is work support. Work support included the Temporary Assistance for Needy Families, TANF program, and the Paycheck Plus program, which is testing an Earned Income Tax Credit, EITC-like supplement for low-income single workers. One of the primary goals of TANF is to increase participants' economic security through employment. This is also the goal of other income support programs, such as the EITC, which provides an incentive to work through offering a relatively large credit to low-income workers. However, when participants do not engage with the program or understand requirements, it poses challenges to reaching the goals of work support programs. In this domain, we improved engagement in appointments and activities in California and New York. Our next domain was child support. In child support programs, parents must often make decisions with limited and complex information, and emotions can run high. These types of situations can affect both the quality and speed of decision-making. Behavioral science can improve decision-making in some of these contexts while providing a new way of thinking about questions that child support staff often confront. In this domain, we improved payment rates in Ohio and increased requests for order modifications in Texas and Washington. The last domain that the BIAS project worked in was child care. The child care domain focused on the CCDF, the Child Care and Development Fund, which has dual goals of supporting parental employment and furthering children's development. It's the largest child care subsidy program in the U.S., and the bulk of the funding is used to provide child care subsidies to low-income parents. In this domain, we improved child care subsidy renewal rates, along with increasing the use of high-quality rated providers. So as you can hopefully see from the previous slide, one key takeaway is that the behavioral insights, while applied to different contexts, can be used across a variety of domains, and the same type of principles and concepts apply even when the domains are different. So to provide a brief overview of our findings, we launched 15 randomized controlled trials. We worked with 8 partners to conduct these 15 RCTs, as they're known for shorthand. So every partner we worked with saw a significant impact on at least one primary outcome of interest. The effect sizes typically ranged from 2 to 4 percentage points, with some with larger impacts. As you can see on this slide, all the way out on the right is Washington State, where we saw a 32 percentage point increase on child support modification submissions. Related to this point is that the interventions were typically very low cost. They ranged from only 10 cents per person to about $11 per person. So for example, in Ohio, where the cost is only about 10 cents per person, that was associated with sending text messages for the duration of the test to clients. On the other hand of the spectrum, the Washington site, which was about $11 per person, was associated with printing materials for the intervention, providing postage, and sending electronic messages to incarcerated parents. So in sum, the takeaway of the project was that while the impacts from behavioral interventions were typically modest, they were consistently achieved, very low cost, and scalable. So hopefully that gets you excited to learn about how you can potentially apply these type of insights to your program. So next, we wanted to jump into the behavioral diagnosis and design. The behavioral diagnosis and design is a method that the BIAS project used, and it's also used by many other behavioral insights teams. If you've listened to any of our other presentations or you have seen any of our written materials, you know that we're always talking about the importance of this process. So the first step is to define the problem. So of course, this seems intuitive that you would want to define the problem before solving the problem, but you want to make sure that you are correctly identifying the problem and you're not presuming to know the reason for the problem without conducting a diagnosis period. So the goal of the phase is to develop a question that does not embed particular solutions, but is also precise enough to be testable. So for an example to help make this concrete, is our example in Texas. So our problem statement was that few incarcerated non-custodial parents submit applications for child support modifications. So a modification application, that's a mouthful, but allows a parent to request a review of their child support order, which could lower the amount of their monthly payment. So for incarcerated parents, this could mean updating their order amount to reflect a change in their financial circumstances since the order was last established. In many cases, since these parents are incarcerated, this would result in a lower child support order. But the way that we framed our problem statement does not assume that we know why parents are not submitting an application. For example, it doesn't say that few incarcerated parents know about the child support order modification program. That would assume that we already know that the problem is a lack of awareness. While that might be one reason, that's definitely or certainly not all of them. So once we've correctly written our problem statement, next we start to dig into the real work, which is to diagnose the problem. So the BIAS team collects both qualitative and quantitative data to identify the factors that may be causing the problem. And then we use that data to develop theories that are based on behavioral research about why the bottlenecks are occurring. So to stick with our example in Texas, one of the bottlenecks we identified was that the letter that the state of Texas was mailing parents may have been hard to understand. The letter used dense language and sometimes confusing jargon, and we even heard from staff that many non-custodial parents struggled to understand the letter. So if the letter is written in such a confusing manner, a parent may choose not to move forward with the process because the deliberation costs are too high. And unclear language would also increase the cognitive load, to use a behavioral term, associated with completing an order modification. So these are the types of behavioral concepts that we would be identifying in the diagnosis phase and that we'll be walking you through in detail later in the presentation. The next phase is the design phase. And this is where we use the theories and other behavioral insights to design interventions that are aimed at improving the problem and that directly address the bottlenecks that we identified in diagnosis. The design phase is what we'll focus our presentation on today when we introduce the simpler framework. And lastly, we test all of our approaches using random assignment, which is the gold standard in evaluation methodology. So in Texas, we ended up designing a strategy that pre-populated the application form, reduced the complexity of the letter, and sent reminder postcards to parents. This approach ultimately increased the number of parents who submitted an application by 11 percentage points. And this arrow shows you just that the process is meant to be iterative. The reason why we feel so strongly about this approach is that it really fosters continual process improvement within organizations to go back to the diagnosis when you find your results of your test or intervention and say, why did it work or why didn't it work? You might have misdiagnosed the problem, and then you might want to redesign a new solution that could address a different set of bottlenecks. So just to sum up the importance of behavioral diagnosis and design, applying this framework was really central to all of the bias tests we launched. It ensures that you are emphasizing the right problem. And what I like to say is just that you're not putting the cart before the horse. You're not developing a solution to a problem that might not exist. And it will also determine with certainty through the test phase that the intervention we develop actually worked or not. So these steps allow us to find out what works in the context of the specific site or program where we are carrying out the behavioral diagnosis and design process. So at this point, we're going to pause for our first Q&A session. I'll turn it over to Xavier to see if we have any questions.
Thanks, Caitlin. Yeah, we've gotten a lot of really good questions in the Q&A box, so thank you for those who submitted questions, and I'll pick out some for our presenters to address. The first one that was a very good question was, what pieces of data or information would we need to help us diagnose what's happening? I'll let either Caitlin or Patrick address that one.
All right, so this is Patrick. I'll jump in. I can think of a few types of information. So one, I think you want to have a really clear understanding of the process that your customers and staff are needing to complete in order for, one of your participants to reach a goal you've set for them or to complete this process. And so we often find that frontline staff or participants have to do things that higher level administrators don't even realize that these staff are having to do, or that might be consuming a lot of their time. So it's really important to talk to these levels of staff and customers and get their perspective.
That's great. Thanks, Patrick, for that answer. Let's see. Another good question that we can pull out of the Q&A box are, what are some examples of problems that wouldn't be amenable to a behavioral intervention? Either of you can take that away.
Well, I think that's a tough question, and it's a really good one. So I think that what it leads me to think about is the simpler framework, and what Patrick will begin to take us through today is to kind of look at your program, at the big picture level, and try to see how these specific techniques could improve certain aspects of the program. One example of something that we might not necessarily consider to be a behavioral intervention might just be a staff shortage. So let's say that your agency is really just short on staff. You might have already applied behavioral insights to try to improve, the forms that your agency uses to make sure that the process is streamlined, but ultimately you could also just have a staff shortage. That's not necessarily something that a behavioral intervention would address in and of itself, but it's more, something that might just require just pure added resources. But I would say the overall takeaway is to really try to look at the simpler framework or other, behavioral insights and see how they can apply to your program in various areas or in various domains.
Great, thanks, Caitlin. And let's just get to maybe a couple more would be great. We have a question that's just been added. Where can I learn more about cognitive load? So I think more generally just resources where we can learn more information.
So I think with cognitive load, I would recommend a book that many of you have probably read called Scarcity. It was published by a few academics several years ago, and it talks a lot about their ideas and their research on the psychology of scarcity, which basically the idea is that particularly when working with low-income populations, they're facing a lot of forms of scarcity, whether it's resource scarcity, time scarcity, etc. And all of us at various points have probably faced similar types of scarcity. Time scarcity comes up a lot, I think, in a workplace setting. And what their research shows is that when faced with scarcity, people's decision-making works in different but very consistently different ways. And so it's really helpful to constantly be reminding yourself that a lot of the people we're working with in government programs are experiencing resource scarcity constantly and how that is shaping their decision-making, and that it's not necessarily that who we're serving are any different than the staff in our programs or us ourselves. It's just that because they're facing these contexts, it's going to cause them to prioritize their short-term needs first or make other types of decisions. So I think that book is a really valuable resource for anyone trying to think about how we can redesign our programs to be more informed and more reflective of people's psychologies or decision-making. Caitlin, is there any other resource you'd want to highlight?
I think that's a great one. So I think I would just highlight that cognitive load is one of the key concepts in behavioral science and behavioral economics, and so we'll dig into that when we go over the framework. But keeping that in mind, Patrick's summary is really important when you think about the type of solutions you can potentially design.
Mm-hmm.
Thank you both. I think we're going to end the question and answer session there, but there will be another one towards the end of the webinar. So please continue to submit questions through Q&A box on your chat screen. So we'll go ahead and move on into the second session or section of our webinar. Patrick, take it away.
All right. Thank you, Xavier. Okay. So I'm going to talk to you a little bit today about the simpler framework. So after we completed the bias test, we took a step back and we tried to identify how staff like you from government and nonprofit agencies and also other sectors could take advantage of the lessons that we learned from the bias project. And we realized that there were 7 key behavioral concepts that we ended up using in almost every one of our sites in bias. And so these concepts or behavioral insights can be applied to policy design at a really high level. It can be applied to communication materials, which is a lot of what we did. You can apply it to your case management meetings where people are having one-on-one interactions, and lots of other areas of your agency operations. And in a fortunate coincidence, these 7 concepts form a hopefully easy-to-remember mnemonic, SIMPLER, which again, SIMPLER is a framework for applying behavioral insights, but ideally we want you to be using it as part of this larger behavioral diagnosis and design process, which is going to really help you develop effective interventions that are likely responsive to the challenges your staff and participants are facing. Okay, so the first term in SIMPLER is social influence, which refers to the idea that our society, our peers, or a person of influence can really affect our decisions and actions. So social influence works in a variety of ways, but one common pathway is that people tend to follow and mimic what they think other people are doing. Chances are the answer to the question, would you jump off a bridge if your friend told you so? In some cases, it's kind of true. So in this case, a common example is when a toothpaste company has an ad with the line, 9 out of 10 dentists recommend our product. That company is using social influence. Social influence addresses many of the behavioral tendencies we all have. such as a mistrust of the unknown. By noting that someone prominent or someone you know, or that most people who are similar to you are performing some type of action, you're persuading others that it's okay for them to do that activity, and chances are they probably should be doing that activity as well. And it's important to note that in some cases, social influence works subconsciously. So as mentioned, we use social influence in a lot of our sites. So a great example is from Texas. Caitlin had already previously talked about this program, and so here we were trying to encourage incarcerated parents who owed child support to submit applications that would modify their child support orders. And this is important to do because getting these parents access to modifications when otherwise they wouldn't be able to make their child support payments is going to help them avoid building up debt while they're in prison, which could then lower their incentives to work and make child support payments when they're released. So among other strategies in Texas, the new outreach we used made use of social influence by explaining that other parents like you have had their orders lowered. This intervention, which incorporated social influence and other behavioral insights in Texas, led to a large increase in the percentage of parents who submitted child support order modification applications. So, in another example that maybe some of you have heard of because it's gotten a lot of press over the years, a company called OPRE has helped utilities send electricity bills to households, which compares their energy consumption to that of their neighbors. And so that's illustrated here in the bar graph. But in addition, these electricity bills are also rating households as whether they're great at being energy efficient, whether they're good or below average, which is shown here with the lovely smiley faces. And so this simple, very low-cost intervention reduced electricity consumption. And in fact, it reduced it by as much as what we would expect to see if energy prices had increased by 10 or 20%. And this just goes to show that low-cost behavioral interventions can really produce meaningful, important impacts. And so in human services and education settings that so many of us work in, I think one takeaway is that we want to avoid suggesting that behaviors we want to discourage are somehow common, that a lot of people are doing them. But we also want to highlight the many cases when most people and most staff in your programs are already doing the right thing. All right, so the next term and simpler is I, which stands for implementation prompts. And so these prompts encourage people to plan out the precise steps they'll need to take in order to complete a task. And these prompts help people move from their intentions or their desire to complete a task to actually acting on that desire. So we use implementation prompts in our Paycheck Plus test in New York City. And so here we used behavioral insights to design postcards and other outreach materials to encourage people to attend a meeting about this tax credit program that could get them significant financial assistance for working. And so in the intervention group, we prompted people to plan when and where they would attend a program meeting. And so people who received the behaviorally informed intervention materials, like this postcard, which included an implementation prompt, they actually ended up attending the meetings at a higher rate than those people who just received the standard materials lacking this type of prompting. And so implementation prompts address several issues, including that we often forget to act on our plans. So these prompts help people remember at the right moment and in the right context and circumstances that, oh yeah, I wanted to carry out this task when I'm faced with this choice. So now that we've introduced another behavioral concept, let's gauge your behavioral instincts with a poll question. Xavier?
Thanks, Patrick. Excuse me. So your friend tells you she plans to vote in an upcoming election. What is one question you can ask her that will increase the likelihood that she will vote? Is it A, who will you vote for? B, what can we do to get more people to vote? Or C, where is your polling station? Submit your answer now, and while people submit and we tally the results, Patrick will provide you with another example of implementation prompts.
Thanks, Xavier. All right, so in another study, researchers sent the employees of a company some mailings telling them about where they could get a flu vaccine. And those employees were split into 3 groups, and they were either prompted to write down, 1, the date that they planned to get their vaccination, 2, the date and time that they planned to get their vaccination, or 3, if they were in the control group, they weren't prompted to either write down the date or the time. And so the study found that vaccination rates increased when employees were given the more specific prompt to select the date and time that they would get a vaccination. So now that we've reviewed that example and given you some additional time to answer the poll question, I think we can turn back to the poll question and see what the results are. Xavier?
Great, thank you. So let's see. The results of the poll have come back overwhelmingly with the question, where's your polling station? With 78% of attendees suggesting that that question could get your friend to follow through with her intention of voting in an upcoming election.
All right, and that's the right answer. So academic researchers and political campaigns have actually done a lot of research on the subject and found that these types of plan-making questions, when will you vote, how will you get to your polling place, etc., are really effective at mobilizing people to vote. And this may be why someone might have asked you in the most recent election season whether you had a voting plan or what was your plan for voting. And so in our social program or education settings, this insight could translate into always going beyond asking your participants to attend a meeting. Instead, you could make sure to provide them with a map to your offices if you're worried that they don't know how to get there or that they'll need to get public transportation. Or you could also prompt them to write down the date and time that they plan to visit.
And I'll just add, I think one thing that's really interesting about this concept and the reason why behavioral scientists have found it so fascinating is because everyone knows in order to get from A to B, you have to make a plan of how you plan to do that. At the same time, these studies have found that simply prompting someone to take those steps makes it more likely that they act. And so it shows that this simple change can really have an outsized impact once you implement this type of strategy.
All right. So moving on simpler, the letter M stands for make deadlines. And so without a fixed deadline for accomplishing a task, it can be easy for people to assume that they'll get around to doing it eventually, but instead they just end up procrastinating. So by setting a deadline, we're framing the activity as important and time-sensitive, which is helping people to focus and prioritize today's interests and today's needs over their future, less pressing concerns. And you're really helping people carry out their intentions to complete this task. So I think it's time for another poll question. All right.
Yeah, we're going to keep you on your toes with these poll questions. For this one is, can deadlines be effective if there is no penalty or consequence for missing the deadline? You have A, yes, or B, no. Please submit your responses now.
All right. And while you're doing that, I'll provide you with a few more real-world examples of making deadlines. So continuing with the bias study with the Paycheck Plus program I was previously talking about, the behaviorally informed intervention materials also included originally an early deadline for when people should respond, as opposed to the control group, which was given a much later deadline. And then once that an early date was passed, the program group was given the later deadline and told, the deadline's been extended. You have more time to attend your meeting. And so this use of an early deadline, as well as the other tweaks to the program group's behavioral materials, resulted in many more participants attending the meeting. And so in a second study, working with an academic journal, researchers found that shortening the deadlines they gave to their referees to return feedback on submitted papers from 6 weeks to 4 weeks significantly reduced the review times that those referees took to submit their work. And importantly, it had no observable impact on either the quality or the length of the reviews. And so returning to the poll question, what did we find?
We found that 64% of you said yes. Deadlines can be effective even if there's no penalty or consequence for missing the deadline.
And I think that's the conclusion you can draw from the last two studies we discussed. And so this is important for thinking about how we could apply the concept of making deadlines to social and education programs. So for instance, let's say you have an open-ended opportunity for people to participate in one of your services, whether it's job training, a fatherhood program, etc. And so you might find that it's helpful to occasionally provide participants with a fake deadline for signing up for that service, even though really they can sign up for it whenever. That might actually get more people to respond and sign up. All right, so I think that takes us to the P in Simpler, which stands for personalization. And so personalizing materials or giving your customers personal assistance when accomplishing a particularly difficult task can really improve your outcomes. And so this can be implemented in both written communications, but also in case management meetings. So, for example, people have limited attention, and so they're constantly having to decide what they're focusing on and what they're ignoring. And so, as a result, they're likely to ignore generic communications, as opposed to if you're including their name on the communication, they're going to see that name, recognize that it's really addressed to them, and probably take the time to review the material. And so agencies can use some of the data they have on their participants or their staff to go beyond just including a name, but also pre-populating forms with other information about the person's circumstances. And so that actually would then make it easier for them, for the people you're trying to get to respond to your paperwork, to respond. If you've already filled out half of it, they look at that and realize, oh, I only have a little bit more to do to complete this task, as opposed to sending them a piece of paperwork where you're asking them for 20 pieces of information, which 10 of them they've already provided to you in the past. And so alternatively, in addition to personalizing your communication materials, agencies should spend time really thinking critically about whether there are any key moments where providing additional individualized staff support to people can really have influence their decisions with long-lasting positive consequences. So, for example, when someone's selecting a school or a child care program, can you provide them with expert support? Or maybe they've just moved to a new house or a new job, and because their routines and their experiences are changing a lot, it's a really good opportunity to provide them with some personalized support and guidance. And so our bias interventions regularly used administrative data to populate the materials with case-specific information. So in one example, in Indiana, we made sure when we were sending reminders to parents about attending appointments to renew their child care subsidies, we made sure to include their exact appointment date and appointment time when previously that information wasn't being provided. And we found that including that very specific information about when people needed to show up, as well as some other changes, resulted in parents being much more likely to attend their appointments and renewing their child care benefits on time, which is really important for maintaining continuity of child care. So in another study, researchers varied text messages that they sent to job seekers in order to try to motivate them to attend recruitment events at job centers. And so they tested the effectiveness of 4 different messages. And so the simplest message kind of served as the control, and that's illustrated here. And then the second message added the recipient's name to the beginning of the text message, while in the third condition, they added the person who was ostensibly sending that message. And in the fourth condition, they added a message, hey, I booked you a place, good luck, to try to take advantage of reciprocity. And so what we want to illustrate is that attendance rates increased with each component or condition that added a new component. and that including the client's name and the name of who was sending them that communication were powerful in increasing attendance. All right, so then next is loss aversion. And so basically, sometimes reframing what we're asking people to do is enough to lead them to a different outcome. And loss aversion refers to people's tendency to prefer avoiding losses over acquiring gains of a specific size relative to a reference point. And so studies suggest that framing an outcome as a loss relative as opposed to a gain is about twice as psychologically powerful or motivating. So for example, you may be willing to mow your own lawn to avoid paying a landscaper, say $50 to do so, but you probably wouldn't be willing to mow your neighbor's lawn for $50. Even though these choices are economically equivalent, it's whether you're spending or you're getting $50 to do the same task, mowing a lawn, reframing how that question is asked typically produces very different behavioral responses. And so now it's time for another poll question.
Yes, we left this poll question up there a little early to give you some extra time to answer this one. We're very curious in how you feel about this one. Which of the following would be more likely to motivate you to bring a reusable bag when grocery shopping? You have A, you will get charged 5 cents for a plastic bag, or B, you will get a 5-cent credit if you bring your own bag. Please submit your answers now.
All right. And while you're answering and we're tallying the results, I'll give you a few more examples of loss aversion. So in bias, we used loss aversion in our study with the Los Angeles Temporary Assistance for Needy Families program, where we designed 2 notices that conveyed the same information, except for one emphasized that the benefits participants would gain from attending an appointment, shown here in the green text, and the other emphasized the losses that someone would incur by not attending this appointment to maintain their benefits. And so when compared to the status quo outreach that these participants were getting, the notice that emphasized losses helped more parents return to be positively engaged with Los Angeles' Welfare to Work program, while the notice that emphasized the gains that people would have from attending this meeting did not produce an impact. And in another study, in the education setting, researchers worked with teachers, and so they split teachers into 2 groups. And so in one group, the gain condition, teachers were given end-of-the-year bonuses that was linked to the performance of their students during that year. And in the loss condition, the teachers were actually given a large lump sum payment up front at the beginning of the year, but then they'd have to return some or all of that money if their students did not meet the performance targets. And so what's important is that the bonuses between the 2 groups were set up to be identical, that, if your students, let's say 70% of them reached a certain benchmark on a test, in both groups you would be getting the same level of bonus. And so really it's all about whether you were getting the money at the end of the year or whether you were starting with the money and you'd have to pay it back if you didn't succeed. And so this study found that the loss condition resulted in students performing much better, suggesting that the teachers really responded to this loss framing of an identical incentive. And so here, I think we'll return back to the poll question. So Xavier, what were the answers?
Right, excuse me, returning to the poll question, most of you, 63% of you, said that being charged 5 cents for a plastic bag is more likely to motivate you to bring a reusable bag when you go grocery shopping. And that's consistent with research that has found that a 5-cent shopping bag tax reduces the use of disposable bags, when on the other hand, a similar policy that offers customers a 5-cent bonus for using reusable bags generated virtually no change in behavior.
And an interesting side note, that study was actually conducted by a former MDRC employee. So it's really exciting that there are so many researchers in academia and policy circles working on these types of questions. And so here we just want to end with our discussion of loss aversion by emphasizing that what we're talking about here is framing the same policy or opportunity as a loss or gain, which is very different from this idea of positive incentives versus negative incentives, or sometimes called sanctions. And so the behavioral science of actually using negative incentives is very different from the behavioral science here around framing the choices people face. So here I'm going to turn it over to Caitlin, and she's going to take us through the rest of the simpler framework.
Great. Thank you, Patrick. So for those of you still with us, you've made it through 5 letters of the framework, which means you're practically experts. And so only 2 more to go. So the next letter in the framework is ease. So ease covers a variety of behavioral concepts about how to make things easier for people to achieve their goals. So studies in psychology have shown that people can only process, absorb, and recall a limited amount of information at one time. So this goes back to our earlier question that someone had posed about learning more about cognitive load. So this is the idea that we cannot infinitely continue to make decisions, make rational calculations, and optimize our choices all day, every day. We have to use shortcuts, and we have to use different ways in order to prioritize the many decisions that we make every day. So, for example, today, when I was running out to get lunch before this presentation, I could have went next door, or I could have went across the street. Across the street has 20 different food options, but it was just too difficult for me at that time to make that decision, knowing I had a big webinar coming up. So I just went next door, even though I didn't like it as much, because it's easier. So another example I think that many of us have faced and kind of embodies this concept is opting out of the many emails that we receive on a daily basis. So we're all, constantly dealing with the marketing ads that keep coming for, various different programs, and so at the bottom of every email there's a little opt-out button, very small text that says if you'd like to unsubscribe, click here. So when you click there, a lot of these companies now make you fill out a form that says, what's your email address, why are you unsubscribing? And so this is not by accident, or this is not because they need this information. It's because they know that by adding additional barriers to getting you to opt out, some people are likely to give up and just X out of that window and never opt out. So they're really capitalizing on, increasing complexity and making processes not easy in order for you to stick with their marketing communication. So on the flip side of that, I don't know if any of you have heard of this new app. I think it's called Wrap Up. And what it will do is it will scan your entire email system and will unsubscribe you from all of the emails that you don't want anymore in one shot. And again, this is just emphasizing that this is easier, and this is reducing the complexity and the hassle for us to click through our emails and opt out of them all. So in this, realm, we looked at a variety of different techniques to make processes across our human services domains easier. So child support, like many programs, is one example of where the legal nature of the system adds a level of complexity for the clients. There is a lot of legal documents that protect both the agency and all of the parties, the custodial parent, the non-custodial parent, and the child. But that type of language can also add complexity because it might not be easy to understand, or the key points might not be emphasized. So in one of our examples in Washington, incarcerated non-custodial parents had to submit an application in order to apply for a child support modification. First and foremost, in the control condition, non-custodial parents were not made actively aware of this opportunity. So in the treatment condition, we mailed these parents a packet proactively that included the modification application, which was many pages, but also included a cover sheet, like a tip sheet, that guided them through the application in a clear and concise way. And so sometimes, even if you are not able to modify or change, the legal documents that I know that many of us have to work around, adding something like a tip sheet is a simple and easy way to get the key information to the parent that might make them more likely to act while still giving them the details that we feel are important based on various different scenarios that the client might have. So it's a balance between those two. And so I think generally this concept, it puts us at a tension between making processes easy enough for people to act, but also being able to give them enough information that we feel like they're actually making an active choice. And so as program designers and program implementers, we often have to strike the right balance between those two things. And so this could mean kind of really taking time to review your documents and review your packet and look at it from the user's perspective to say, do I have the key information in this packet, but is it still easy enough that I think I'm not, designing or, creating barriers that a client now needs to get through. So yet another poll question. So Xavier, do you want to read us this next one?
Sure. You are trying to refer a customer to a form on your website. Do you, A, give the customer the URL to your website's homepage and provide instructions on how to navigate to the form? For example, you might give the customer www.mdrc.org, or B, give them a longer URL that takes them directly to the form. For example, you might give them www.mdrc.org/forms/ta.pdf. Please submit your answers now.
Great. So without giving away this answer, the Behavioral Insights team did this type of study where they actually compared responses when they directed people to a web page containing the form versus a link directly to the form. And what they found is by simply adding in that link directly to the form, they increased response. And so this is just another example of how sometimes very minor changes, it could be, 10 seconds of our additional time to kind of add that, remaining link that could end up having a big impact. So do we have our poll results?
Our poll results are in. So it seems that 80% of attendees have suggested that giving their customer a longer URL that takes them directly to the form is a better way to refer your customer to a form on their website, which is consistent with the study that we just discussed. So that's great.
Great. So our last letter in the framework is reminders. And I think that reminders need no introduction or formal definition. I think we all know that we procrastinate, it's our human nature, and reminders can just help offset this. So our last poll question, how often does your agency send customers reminders when they have an important appointment or deadline? A, consistently, B, sometimes, or C, never. So we'll let you get those poll answers in. I think when it comes to reminders, it's not only providing reminders, but it also could be thinking about the timing of when you're sending that reminder. So one rule of thumb is that ideally you would be reminding someone of an action when they might be likely to act on that behavior, right? So, for example, I might remember that I need to pay my electricity bill while I'm in the car on my way to work. That's not an ideal time because even though I've remembered it, I might forget it by the time I'm actually at home and have my checkbook in front of us. So how can we not only think about ways to send reminders, but send them at the right time that could increase the chances that people see that reminder, immediately act, and complete the task that we're hoping they complete. So in one example from our bias study, we tested no reminders versus reminders. So there are some non-custodial parents who have child support orders in Ohio, and these parents were not being sent monthly reminders that their child support bill was due. So just like all of us, receive a credit card statement when our credit card bill is due, these parents weren't receiving any type of notification. Now, you could make an argument that parents should know that paying their child support is important and thus come up with their own strategy for reminding themselves that this is due. But there's a chance that this parent could go through the entire month, get to the end of the month, and potentially forget to make a payment. So in one of our treatment conditions, we tested sending a reminder. So we sent them a mailed payment reminder in the middle of the month and followed up with a robocall towards the end of the month. And this strategy did increase the payment rates on child support orders. So it looks like we have our poll answer in. Xavier?
Yeah, great. The responses to the poll indicate that 45% of you consistently send customers reminders, 45% of you sometimes send customers reminders, and 9% of you never.
So maybe we have a motivated group here because you were motivated enough to sign up for the webinar, but these are very impressive. It's great to hear that 45% of you are consistently sending reminders, and that another 45% of you are sometimes sending reminders. So you've cracked the code and understand that this is an important method. So your answer to the previous poll question, if it was sometimes or never, why doesn't your agency send reminders consistently? A, we cannot afford the cost of sending more reminders. B, we do not think sending more reminders will improve response. C, we do not have the technological capacity. D, we do not have enough staff to create and send them. E, other, or F, NA. So in a last study to showcase the importance of reminders, researchers conducted a field experiment with 3 different banks in Bolivia, Peru, and the Philippines. And so in each experiment, individuals opened a bank savings account, which included varying degrees of incentives and commitment features that were designed to encourage individuals to reach their savings goals. So some individuals were randomly assigned to receive a monthly reminder via a text message or a letter, while the control group received no reminder. So simply sending these clients a reminder to save increased the likelihood of reaching their savings goal by 3%, and also increased the total amount saved in the bank by about 6%. And so we picked these examples because we wanted to demonstrate that reminders don't always work for they don't only work for things like appointments or filling out a form, but they can even work for larger, things like saving money or making a child support payment. And so for our last poll question, I know that since many of you were already, consistently sending reminders, this might not apply, but it looks like our top answer was that we do not have enough staff to create these types of reminders. And that's really consistent with what we have also seen in our bias work. We know that staff have limited time, and we know that they have limited resources. And so sometimes creating those reminders can be time-consuming. I think one of the things we have tried to think about and would hope to think about in the future is kind of the immediate needs that the staff is dealing with versus the potential future benefit of taking that time to send the reminder. So how can we think about programs differently if we know that putting in the time now could get us a bigger impact later? And how can we potentially think about that with our limited staff resources that we all face? So with that, we have concluded the 7 concepts that make up the simpler framework. As as a recap, those 7 are social influence, implementation prompts, make deadlines, personalization, loss aversion, ease, and reminders. And of course, we couldn't end without re-showing one of our key methodology, which is the Behavioral Diagnosis and Design Framework. So while the simpler framework focuses on that design stage, which we thought it was very important to, kind of emphasize here, given that we wanted you all to walk away with practical tools that you could start applying right after the webinar, we also wanted to emphasize that the design stage should ideally only come after properly defining your problem and diagnosing what is happening based on your available data. And it's also important to test the designed intervention to see if it did indeed make a difference. Behavioral science would tell us that we have a tendency to rely on our intuition, and so sometimes we might think something is working without actually testing whether that is working. And so this framework really ensures that we know with certainty whether or not our small adjustments or tweaks are working. Another closing point about the simpler framework is that we don't want you to think that this is just a framework to apply to written documents or communications. We think of simpler in a more broad way. So hopefully you'll take a look at your entire program or process and think about how these concepts could relate not only to the written documents that you send clients, but also to your interactions with your process for how clients need to flow through the system, etc. So next up is our next Q&A session.
Yes, so here we'll have a little bit of a longer Q&A session. Many people have submitted a lot of great questions, so thank you all for submitting questions. It's very helpful for the webinar. So I'll start out with this first question to either one of our presenters. In the texting example that you showed us, the more behavioral interventions you used, the better the experiment did. Do you find that including multiple behavioral interventions is almost always better than including just one?
Well, that is a great question, whoever wrote that. So this is something that the bias team often went back and forth with. So going back to the goals of our project, we really wanted to ensure that we had a positive impact on the agencies that we worked with. And so what that often meant in our case is employing multiple behavioral techniques bundled into one behavioral intervention. So there were several sites that incorporated, all 7 of those techniques. So what we generally believe that if you're doing something like crafting a communication, you have the opportunity to use more than one technique, and you should, use that opportunity. The downside, I think, is if you are struggling with limited resources, and so you're kind of going back and forth between, should I redesign my letter and incorporate social influence, or should I implement a texting reminder? It might be nice to know which of those 2 things are working better. And then so that could be almost a next phase of your intervention, is to kind of then try to piece apart, if you do find a positive impact, what components that you utilized are working. Patrick, would you like to add anything?
Yeah, I would just want to add that I think Caitlin did a good job of explaining why we used bundled interventions with so many behavioral concepts, and this was to increase our likelihood of having an impact. However, I definitely do not think that more is going to always get you to a better or greater impact. There's definitely a number of studies which have found diminishing returns, and sometimes even that simpler intervention that just used 2 or 3 as opposed to all 7 ideas can be more effective. So this is why testing is so important. So in general, it's good to consider all the behavioral concepts, particularly like simplification and ease is always really helpful to be thinking about, but it's definitely not the case that more is better. Next.
Great answers, thank you. Okay, I want to ask you guys a tough one, since I don't want to just give you some easy questions. Here's a good one. When you're leveraging social influence, do you worry about reactance? So do you worry how to reduce the likelihood that some recipients will experience reactance and actually behave in the opposite manner in which you intended?
I mean, I think it's a great question. I think that, yes, we do worry about reactance. I think if I'm thinking about it right, it relates to social influence, but I think it also relates to any type of behavioral technique that could seem disingenuous or could seem, like you're trying to push them into one direction that they think that you want them to go. So I think it's all in, hopefully, the way that the messages are crafted. The other thing with social influence is that we try to stick with only factual information. So we would not say 90% of clients are doing something if 90% of clients are not doing something. So I think it's really making sure that you are staying truthful and you're staying accurate. But I think that it is a risk, especially depending on the type of message you're crafting.
Mm-hmm. And I think this is why, again, I mean, we're going to constantly, I feel like, preach this point, but why testing is so important, because the concept of social influence might work in your particular context, but it might take some testing to find whether, a light touch, where it's not the primary message you're motivating, or, putting it up front and really emphasizing it. Those different approaches to using social influence might work better in certain circumstances and kind of cut down on this concern of reactance.
I guess I'll just add one more point too, which is about when you're thinking about social influence and who to use. So Patrick gave an example of, saying to patients that 9 out of 10 doctors use a toothpaste, or saying that to consumers. But another thing to keep in mind is to make sure that you're using the right person of influence with the right group. So let's say you're trying to encourage community college students to get through their remedial or developmental education courses, which are kind of a step behind typical community college, and they need to catch up on math or English. It might not be effective to show a video of someone who attended Harvard saying, their math skills are very advanced. So it's also making sure that you've really thought through what the right group of influence is for the given population.
And that's a really good point, which makes me want to just note that there is research supporting the idea that the closer you can get your comparison group or your social influence messaging to identify people who are closest to the people you're trying to persuade or change their decision making, the closer that connection is, the more effective the social influence intervention typically is. Okay.
That's great. In one of your answers, Patrick, you mentioned the importance of testing. And along those lines, we have a good question. How long does the behavioral diagnosis and design process typically take?
Okay. So I think it varies a lot from, which is a terrible answer, but I think you definitely want to expect to spend several months in diagnosis, because you're going to find that with each additional level of staff or additional customers you speak to or additional observations of meetings or review of administrative data, you're going to get additional insights which are going to partially conflict or be in tension or make you think, how do I square this insight with what I've previously learned? And so you want to be able to kind of constantly, it's an evolving process where you're incorporating a lot of information, which sometimes can take a while to acquire, for instance, if you're working with administrative data. So I think you definitely want to expect to spend, depending on the complexity of the issue you're trying to address, several months in diagnosis work. And then, again, similarly in intervention design, you're going to want to run through a lot of iterations. And so it doesn't necessarily have to be months, it's really the amount of time. So you could imagine, if you were to concentrate solely on improving a communication letter or coming up with a script to help guide your staff through a meeting, that, if you're just constantly iterating and sharing with others for feedback and incorporating it, you could accomplish that process in a few days or several weeks. But if you want to give time to people to reflect and everyone's juggling lots of work responsibilities, it might also take several months. Caitlin, do you have anything you want to add?
I would just add also just to not be the perfect, be the enemy of the good. So doing any diagnosis is still better than doing none. And so I think any time that you could dedicate to exploring your processes and getting various perspectives is a positive.
Mm-hmm. And this is why iteration is important, because you can spend a little amount of time, make a change, see if there's a really significant impact, or if not, and then you realize, oh, let's try it again. Let's try to get a little more information. Let's talk to this type of staff, etc.
Great question. Great answer. Yeah, we've had a lot of really insightful and thoughtful questions come in, so I really appreciate all the great questions from our participants. Here is another one. This one's very insightful, so I hope to get some insight from our presenters as well on this one. Scarcity research seems to indicate that our programs need to be more flexible to account for people's bandwidth challenges. Do you think that shorter deadlines could have a negative impact from a scarcity point of view?
So this we've actually been thinking about in some of our more recent behavioral research after the bias project. So we're doing a project with the Office of Child Support, which is applying behavioral interventions to child support agencies, called BICS, or Behavioral Interventions for Child Support Services. And we run into the issue where, in many cases, states have established very lengthy deadlines to give parents the opportunities to return paperwork or complete processes, given how important the financial consequences of these decisions are. And so when we look at those deadlines, our first reaction, a deadline of 45 days or 60 days, because that's not even in the same month, it just very clearly strikes us as when you're given a deadline, like you need to return paperwork in 45 or 60 days, people are going to automatically say, oh, I'll turn to that a little later, but then inevitably they forget ever that deadline was approaching. And so we felt like it was probably a good idea to give people the opportunity to respond more quickly. And so that makes us want to consider earlier deadlines. But again, because we do want to be respectful of the fact that, maybe it really does sincerely take people 45 days to gather this paperwork, that we always want to be testing those types of changes to ensure that we're making the best choice for our participants. But again, it's kind of a balancing two effects in that there are probably some people who would benefit from the additional time to gather the materials or have a longer deadline. On the other hand, there are lots of people, and there are a number of studies supporting this, that if the deadline isn't timely and very short, they're not going to respond, and all of their response is really key to that deadline. And so it's best to set an early deadline so that way people have lots of opportunities to recover or adjust if they don't hit that initial deadline. Caitlin, do you have thoughts?
I think I'll just also add, I think it's a great point, and it is a great question. You also might want to, again, take a step back and look at all of your program steps and figure out, okay, right now I'm giving clients 5 deadlines because there are 5 key activities that they have to do. Can I, taking a step back, look at that process and actually condense 2 steps into one and give fewer deadlines. So I think it's also this balance of kind of what are you asking clients to do and making sure that you're kind of maximizing what you're asking them to do with knowing that scarcity is a true concern and a real concept.
And I just want to quickly highlight a concrete example that I'm guessing many of you are familiar with, is that a number of our safety net programs, Medicaid, food assistance, child care support, etc., they all have deadlines requiring people to every few months or every year re-document and re-prove that they're eligible for the program. And so a lot of states in the last decade or so have made a lot of really good progress aligning all those safety net programs. So if you're someone who is getting both child care and job search assistance, how can we make sure that the deadline for you to prove that you still qualify for those services is at the same time, and that way you're not constantly, like every month is a different program and a different deadline. Let's have all the programs which are using similar information to ask you once every 6 months, once every year, et cetera, and get all the program recertification deadlines out in one step. Okay?
Great, thank you both. How about a practical question for our audience? Do you two have any suggestions for overcoming present bias? One person says that it's their biggest issue when it comes to motivating staff to send reminders.
Great question. So I think that what we've been exploring to overcome present bias, a few things. So I think one is making sure that you take a look at the staff incentives and what the staff are being rewarded for doing. So a lot of times, we see, and it's very common, that staff are being asked to do several things, but at the end of the day, they need to report on how many clients they've seen, and the amount of paperwork they've gotten through. So I think there needs to be some thought at a higher level, the management level, about, are you making sure that staff feel rewarded for doing something like sending a reminder? Then I think on a practical level, it's taking the future and trying to get it into the present. So it's trying to give staff tangible ways in which what they do now will pay off in the future. So I don't have, a perfect example, but maybe it's even demonstrating with a client how that reminder really helps them act. And so this was one of the, when we did our qualitative interviews for one of our childcare sites, we heard from clients that the reminder really helped. And so then feeding that information back to the staff helped them see kind of a concrete impact of what they did. So I think it's also feedback and making sure that the staff are being updated and in some cases rewarded, even if not financially, but through motivation about what they're doing, and that it is actually making a difference if you're seeing that or finding that it is.
That's great. Yeah, I was just thinking, Caitlin, that this idea of incorporating staff and making them aware of the benefits, particularly if you've been able to test, for instance, in this scenario, sending reminders that you know that it works, making sure that staff are aware of that, and then reinforcing that knowledge with the incentives like Caitlin talked, or with making changes to staff culture and staff training. So it's really like the default is that staff always know that they're supposed to be sending reminders when participants have to complete a task.
All right, thank you both for your great answers. And once again, thank you all for submitting great questions. Excuse me, we tried to get to as many as we could, but as we're close to the conclusion of our webinar, we want to make sure to highlight some resources for you all.
Great. So to wrap up, resources, of course, our websites are a resource, so direct link to the CABS website section of the MDRC website up here, and also the direct link to OPRE. And we have several publications and dissemination points that are upcoming. So first off, we have a newsletter called the Behavioral Buzz. It is the bias newsletter, and it will provide tips and updates about how different studies have worked and different behavioral concepts might be used. So please sign up for that. I think we have a link at the bottom. We also have site-specific bias reports, so if you're a practitioner in child care or in child support and you really want to dig into what we've done in that specific domain, head to our website and you can find all of our reports there, and we have a few more that will be rolling out in the next several months. We have our bias capstone final report, so this is really synthesizing everything that we've learned across the bias tests, and also looking forward into the future of behavioral sciences within social and education programs. Our websites again, Twitter, and our contact email. So our email is be.info@mdrc.org. I know that we also had some other questions that we couldn't get to that I thought were really interesting. For example, one about the ethical considerations with testing. And so if you send us an email, we would be happy to answer your questions or speak with you more about any of those. And then just generally, bias, and the future. So we are not done with all of our work in human services. So we have the Bias Next Generation project, and this project will expand into new human services domains. And if you are a part of the Bias Next Generation project or potentially would like to be part of the Bias project, we would conduct an in-depth behavioral diagnosis of your program. We will develop customized behavioral interventions with professional design. And we also employ capacity building, technical assistance, and support in order to make sure that the lessons that we have and the insights we have are shared with all staff. And again, there's our contact info.
And Caitlin, I just want to add that this Bias Next Generation project is really obviously in large part due to the support of the Office of Planning, Research, and Evaluation, who are funding this research into how behavioral insights can improve human services programs. And in particular, they've done a great job with the Bias Next Generation project in that they're emphasizing developing a lot of practitioner-oriented resources. So not only providing really strong support to the sites, the agencies who are participating in the project, and if you're interested, obviously send us an email, but then they're also making sure that all the lessons and experiences we have, we're able to share them with all of you and the broader community.
And I just want to remind everyone that we'll be sending out an email to all attendees with this slide deck, along with all of this information and relevant links, and we'll be sending that information out within a week.
So thank you everyone for joining the Bias Capstone webinar, and we look forward to hearing your thoughts on Twitter and over email.
Thank you.